Hello everyone, I am Dr. Sagar Bhattad, Pediatric Immunologist and Rheumatologist, Aster CMI Hospital, Bangalore. The last decade has seen a phenomenal change in the field of clinical genetics, at least in India, where now genetic testing is not only easily available but is affordable and accessible. Now we have labs that offer something called whole exome sequencing, clinical exome sequencing, and occasionally some labs will tell you about whole genome sequencing. It's pretty confusing for clinicians out there, and let me tell you, these tests should not be ordered without a proper understanding. Why? Because whole genome sequencing is only and only for research purposes. Here the entire genome is sequenced and a lot of information is produced by this which may not be interpretable in clinical situations. What in clinical practice we do is, after a thorough clinical history and some basic investigations, we come to differential diagnosis. And if I think of a genetic disorder, I list down the number of those various genes that are possible differential diagnosis in my patient, and thereafter I order a whole exome sequencing. A whole exome sequencing will sequence the exons of all possible genes. Exons are those portions of DNA which code for proteins, and that is why a whole exome sequencing may be the right approach in a given clinical scenario. Again, let me reiterate, a genetic test should not be ordered without understanding why a particular test is being ordered. Thank you.